I'm Dr. Neeraj Jain. I'm Senior Consultant Spine and Pain Specialist at Yashoda Super Specialty Hospital. Now, this program is for the awareness of the public. We have to understand pain is something which is treatable, which is curable, and there is no malady in suffering. 50% of the patient come to the hospital for the reason of pain, and of them, almost 50% would really need a serious pain treatment, and they need some care, so that otherwise they don't keep running around different disciplines, different departments just for the reason of pain. Because pain is treatable, curable, and there is no malady in suffering, as I mentioned earlier. Now, what happens is, it is the data in the US and other places that there is so much of time loss and money loss and work days loss because of the low back pain. It is getting is more and more of a lifestyle disease now, with a modern lifestyle and more and more mechanized life now. We are going away from nature, so people are suffering more often with some newer diseases. Like, give you an example, more and more people are working on laptop and work from home. And what happens when they did work from home? They are not having a natural posture. Like, we always keep advising them for a good posture. And it is said, if you don't have a right posture, there is more and more reason for the low back pain. So the first lesson for the public for the back pain is posture, posture, posture. If you're conscious of the fact that you're keeping posture right, your lower back pain issues almost reduces to half in as per whole population. As it is said, 80% of people will suffer from back pain in lifetime once or the other time, and 20% at a given point of time suffer from back pain in a subset of population. Like, we have a 3 crore population in Delhi, so almost 60 lakh patients are suffering from the low back pain. The idea is, of them, almost 10% would really seriously need some surgery or some intervention. 90% are still curable with the physiotherapy, lifestyle, posture corrections, and that we should look for. And we should have a healthy eating, healthy habits, and an exercise, routine exercise that takes care of the most of the pain part. Yes, there would be some disease, some organic lesions. Like, I'll give an example, like slip disc. If somebody wants to prevent slip disc, obviously per se, but if it still happens, now we have a non-surgical treatment for the slip disc also. We don't have to go for surgery. Almost 5% of the slip disc patient would need surgery. 95% can be corrected with our domain, which is Interventional Pain Management, Spine and Pain treatments. And this is all a needle treatment. There are about 6-7 types of those treatments, which you can call it as a needle discectomy. Whether it's a ozone discectomy, whether it's a drill decompression, whether it's a RF ablation or arthrochir ablation, or at the most dissection, and the upper level is the endoscopic discectomy, which gives very good result even in very bad disc disease patients. Nobody needs to suffer. I have seen people and they delay the treatment and they get paralysis. Now, that's something very bad. If a young patient, and it happens very often in the working age group, like 20 to 40, if the young patient gets a very big disc disease and they get a issue coming in the legs, there's a weakness in the legs, numbness, tingling, and that is not to be neglected. And if it comes to the ball and bladder issue, like they have a problem with urination or motion, then obviously it's a very serious matter. It's a neurological sequelae which is already imminent there. So why should not lead that happen? Because I've seen patients with permanent paralysis also in some of these patients. So that shouldn't happen, because we've got a very good non-surgical or least invasive treatment for these patients, which gives almost 100% result. So one should go for it at right time. The timing is the crux. Time is the issue. And if it is one of those troubling back pain, nagging back pain, which is killing, the family and the patient, and the nagging one, and time, and mind, peace of mind, and those ones we have lower treatments, which is needle procedures. Like, many times it is a facet joint pain, so it is treatable with radio frequency. We have SI joint pain, which is treatable. If there is a root compression, we can open up those roots with the injection treatment. So these are very good non-surgical treatments, which gives a very good response and should be taken up if it is not being managed with the medicine, lifestyle, and physiotherapy. Obviously, that's the first thing to do. Now there is another point, like in osteoporosis. In older age group, we know the life expectancy is increasing. We all have to live longer. But when we have to live longer, we have to live healthier also. For that reason, we have do's and don'ts. But one other thing which comes and bothers especially ladies in postmenopausal age group, is osteoporosis. And they keep getting very bad osteoporotic pain, but sometimes with a very trivial minimal trauma, they keep getting osteoporotic fractures. Now, these ladies, once they get fracture, they neglect it, and even family neglect it, because they've been normally told for surgery, which at that age they don't want, especially the patient and even the relatives don't want. They don't want to risk old age people life because they have comorbidities also. उन लोगों के लिए it's so important that we do a very good treatment now. That is a needle cementing. We put a needle in the vertebral body and we just inject cement, liquid cement inside, which hardens in 5 minutes time. This is vertebroplasty and kyphoplasty. It gives near 100% result, instant now, that within 10 minutes patient who came in a stretcher can go walking post after the procedure. Within 10 minutes patient can go walking, and procedure is just half an hour procedure. They go walking home. So it's such a beautiful procedure. In fact, they forget they have, it's like feel and forget it. They forget this pain. Now this is our duty. We should not leave these patients, because there's sometimes if we leave them alone, they have a cord compression and again they have a paralysis and ball bladder involvement. Say that we feel it and forget it, then it becomes all the more important. Ek vertebra one is fractured, but others they also need a treatment. So we have to treat osteoporosis aggressively to avoid any more fractures. Otherwise there will be more and more fractures in down the line. So that is to be taken care of. Lifestyle, diet, and osteoporosis treatment becomes part of the treatment, because we have one life to live. These people have one life to live. So we don't want them to live suffering with the pain and the whole family suffering, because the family results are very poor in modern lifestyle. We don't expect that a whole person who are working the family, they can care these old people and stay back home. It's not like an old time joint family system. Now with these nuclear families, it is results are poor, so we have to treat them and get them back on their work and track and normal lifestyle. So one old man or lady, if they get sent into the bed, then it's a vicious cycle. It is said the mortality even is high, death rate is also high in these patients. So that is to be avoided. Give a simile, there used to be hip fracture, patient used to lie in bed for 6 months. No. These days we just put in processes, patient walks on the third day and they're back to normal to life. Same thing happens in fracture spine also. We have to put them back on life as soon as possible. Now coming back to the point, like these people have arthritis also, especially older age group. Even in young age they have arthritis, that is more of a sports arthritis. But then we have arthritis of old age which is degenerative. Now we have a treatment of regenerative medicine in these degenerative arthritis patients. What we do is, we do treatment for pain which is RF, genital RF and all. But then we have treatment for the arthritis pain treatment which is the regenerative medicine. Now what we do is, we take the blood and we make a stem cell out of that and we put it back into the knee. It's not just one of the visco supplement or grease, it's more advanced treatment. It is making your knee young again. That happens in other parts of the body. Make the body young again is this philosophy. That's a regenerative medicine. It is becoming big, it is modern, it is new treatment and it's a futuristic treatment. Same we do in disc also. A younger patient comes to us with a diseased disc or blackening of the disc, and that's not normal. Older age, yes, like hair goes grey, the disc becomes black, but that happens. But here is a young patient who has got a black disc. We don't have to kind of operate, and but still patient is suffering. We don't like that suffering part. So we have a regenerative medicine and we do a stem cell therapy or PRP therapy or BMAC therapy in the disc also with very good results. So they're back to normal. We want to give them back their culture of work and forget the pain part and be back to the working domain there which they belong to. Same way we have patients who come especially in modern lifetime and the age increasing, there is going to be more and more diseases like digital disease. But one other which is very important factor is the cancer. Now more age the population, more is the chances of cancer. Although it happens in younger age also, but in the older age it is commoner. Now we have to treat cancer in any case. Now we have a medical oncology, surgical oncology, radiation oncology and other treatments are there. But over and above, which is really treatable is the cancer pain. Now it is seen, whatsoever stage of the cancer, like people normally present in very late advanced stage of the cancer, and the most ominous and most disturbing symptom is the pain. And that needs palliation, that needs care. Cancer needs its own treatment in its own right, but pain is something which is real in cancer scenarios and treatable. I've seen people who are suffering with the cancer pain so much so that they demand suicide, they demand for death. And that's not fair. Because patients dying every day because of pain. That's not fair. The idea is cancer pain is treatable and it is almost most of the time is 100% treatable in most of the scenarios. And that is doable. Let them not suffer, because suffering is not only with the patient. suffering stays with the family also. The patient dies, the whole family, keeps suffering because of the trauma of the patient who suffered the big pain and the helplessness on part of the patient and the relatives and very often the doctors also. Now we have a cancer pain management treatment available. It should be tried, it should be done, it should be given. Patient has got right to live pain free as much as one can. Although there can be a prognosis difference in the part of the cancer. Patient may live or die, but patient should not die in pain and patient should live pain free. That's the motive of the cancer pain patients. And the idea is people don't know about it. That is something I've seen when you treat advanced cancer patients, they want to go back to their hometown and they want to be back to their family. They want to spend quality time. We shouldn't forget like great movie like Anand, where it is very, very evident that how much is the suffering and how much is the importance and goodness of life means. It is said when we can't add days to life, we start adding life to days. So it's the quality which becomes important at that point of time instead of quantity of life, and that should be our motive. Another very important domain is that we have seen that people have neuralgias like trigeminal neuralgias, herpetic neuralgias, and so many neuropathic pains are there. They are again are treatable. One does not need to suffer long term. It is said more chronic is the pain, more deep rooted is the pain. It's like a tree. When trees goes up in the sky, the roots keep getting deeper. So if you leave pain for more time from acute to chronic, it's getting more deep rooted in the brain also and becomes more and more difficult to treat. The idea is treat it timely, treat it urgently, treat it justifiably and effectively. Because treatments are available, one should not keep running around and looking for the treatment for pain, especially for pain. Other treatment you have to manage, like arthritis and all you have to manage. But pain is treatable, like cancer is treatable. Osteoporosis fracture is treatable. Another treatment should go parallel, but pain should be taken care of because pain is a symptom. Because it's already said, pain is a pain is a pain. Just lage wotan jane, like people talk about the quantity of pain and it is treatable. And this is something which if takes it away from the patient and then patient becomes very, very comfortable, patient is back to life, the family is back to life and family is back on track. And one life to live, maximize, one should not be suffering for long and there is a treatment available. And yes, at right help, at right time and at right place is important and that's what we are here for. Another very important message I want to give to the youngsters, especially youngsters. I've seen these days there's a very big menace and that is the WhatsApp and the mobile menace. I've seen people, especially younger age people, even kids, they are starting working on mobile for hours together. It's an addiction. You need mobile for reasons, fine. But when it becomes an addiction and you get more and more used to your mobile and hours of, non-stop of the either viewing movie or messaging and texting, and that too in a wrong posture. If you have to do anything like computers and mobile, do in front of your eyes. It should not be put, the neck should not be bent forward and downwards for long time together. It is said every 5 degrees of neck you bend, there is a 5 pound of weight which is increased onto the neck muscles. And for 15-degree angle, which normally people adopt 15-20 degree, you can imagine how much weight is there on the neck muscles and they start crying of pain. Now these people keep suffering. So there are fewer diseases which I have never seen earlier in the younger age group. We start getting more and more commoner in the younger age group. So that is something is to do with the lifestyle. Be very conscious, be thoughtful of it. If you avoid, do a right posture, avoid hours of continuous working either on laptop or on mobile. There is a norm to that. Ergonomics is important. Front of eye, all screen should be in front of eye and your shoulder should be rested, well rested. Other people keep getting the shoulder blade pain, upper neck pain, upper back pain, and this is a common thing and you don't expect much of the intervention or treatment. It's just a physiotherapy, but more important that is prevention. It's preventable. Because people don't talk about it, so more and more people are suffering and more younger people are suffering because of this, and that has to be taken care of and to be avoided. If you go to a mall or metro or restaurant, you see out of 50 people, 40 are all on their mobile, which is very, very, very common problem. It has become a lifestyle, it's a necessity, but it has become an addiction also. So we have to avoid and take care of this part. Thank you so much.